Well, coming up today is the Great American Smokeout.
We'll talk to two experts on ways to quit smoking as PHL 17 Morning News continues at 6:24.
Welcome back, everybody. I'm Jennifer Lewis Hall. It is Thursday. Glad you're with us.
And I'm Zachary Lajwe. It is the Great American Smokeout today, happening today, and joining us this morning is Dr. Stephen Rosenberg and Cindy Reese to talk about some tips to help smokers quit the habit. Always
Glad
good
you're
tips.
both with us this morning. This is serious stuff. I mean, I was looking at some statistics. 42 million Americans still smoke cigarettes. And just even trying, they say, to quit for one day is a big achievement. Dr. Rosenberg, what can you tell us about where people can really begin?
Well, it's a real good situation to get everybody interested in stopping smoking today. That's the reason for the Great American Smokeout. And at beatcancer.org, which we represent, it is an organization that actually allows people to get educated in cancer prevention. So therefore, on our website, we have tips galore at quititnow.com, where we can give you step-by-step 12 steps to stop smoking today. And anyone who wants that situation can get it, free download. Or if you don't have a computer, give us a phone call and we'll be happy to send it to you free of charge.
And I know this morning we're talking about some folks who stop smoking actually use the method of hypnosis. What can we learn about that this morning? How does that play into the...
Hypnosis is a very good way of stopping smoking. In fact, that's what I did. I was a 3-pack-a-day smoker myself. And I stopped with self-hypnosis, and it is 90% successful to stop smoking using hypnosis. No drugs, no gum, no medication, just your mind.
I was going to say, this is where Cindy comes in, because Cindy, it is so important, you're saying, to do that, take those steps with the tips, but also you are a registered, if I understand.
That's right, that's right.
Yes.
And using hypnosis, it's an alternative where you are in a relaxed state, and then you can, you're more likely to take the suggestions that help you change your thinking. And once you change your thinking into a more positive, healthy way, then you can quit. And it makes it very easy.
I know Dr. Rosenberg referenced the number 90%. With your findings and with your patients, how successful is hypnosis in this?
I can't brag to the 90%, but it's been very successful. Yeah. And most people who do it are ready to do it, and that's a big and very important thing. You have to be ready to make that change. You can't do it for someone else. You can't do it because you have to be ready. Right. And once you're ready and you're open-minded enough to give this a try, it will work.
Well, Cindy, you'll be back with us again. We can talk about some specific tips for folks, so they should stay tuned with that and more on hypnosis.
That's great.
And the Great American Smokeout.
Great.
Thanks for being with us this morning.
Thank you very much.
Thank you.
Now,
congratulations.
Well, coming up today, it is the Great American Smokeout.
We'll talk to an expert on ways to quit. That when PHL 17 Morning News continues at 7:24. Thanks, guys. Glad you're with us. I'm Zachary Lajwe.
And I'm Jennifer Lewis Hall. It is November 19th, I should say. Thanks for being with us this morning. The Great American Smokeout is today. That's along with the American Cancer Society. And Cindy, you are back joining us this morning with more on where people can get started.
Absolutely. The best place to get some tips is quititnow.com. But let me tell you some of the things that I have found that are the best tips. First of all, switch to a brand you don't like. If you smoke a menthol, go to a plain. If a plain, go to a menthol. Second one, postpone that first cigarette in the morning for as long as you can. And then with each urge, say to yourself, I'm not going to have this cigarette, maybe the next one, but not this one, because forever's a little overwhelming. So it's be in the moment, one urge at a time. The next thing, don't empty your ashtrays.
Wow, that's interesting.
Or put all that stuff in a jar so you can look at it and see it and take a whiff of what you're not putting in your body every once in a while.
Wow, that's a powerful.
So that's pretty powerful, yes. Don't buy a carton, just buy a pack at a time. Set a date that you're going to quit, and then get your family and friends, in place to give you support. Put the money you would have spent in a jar, and then when you quit, go do something wonderful with it.
It sounds like a good plan right there.
Right.
Drink lots of fluid. Keep your hands busy if you knit or clean or wash the car or something like that. And is there time for one more?
Yeah, one more.
Change your routine. If you sit in this chair, read the paper, and smoke the cigarette, sit in that chair. Whenever you can, change your routine.
Those are some really good tips, and we hear that the benefits of actually quitting show up pretty soon.
They do. They do. As a matter of fact, 8 hours after you quit, the remaining nicotine in your bloodstream is reduced by 94%.
Wow.
After 12 hours, your blood oxygen level has become normal.
Awesome. Thank you very much, Cindy. So it can be done.
It can be done. It's never too late
and
to
it's
quit.
going to be done.
Absolutely.
How about we say that?
Yep,
Cindy Reese?
absolutely.
Thank you so
very
much
much
for joining us.